Arthritis and the need for a balanced diet and protein. The condition that is commonly referred to as simply arthritis is actually nearly 100 different conditions, each causing different levels of pain and loss of mobility. According to the Arthritis Foundation, there are over 20 million Americans of various ages that suffer from some form of arthritis severe enough to require medical attention. These conditions affect women far more often than they do men. In those that are predisposed to certain types of arthritis, it is important to make sure that the optimal health level is maintained, including achieving and staying at a healthy weight. Learning as much as possible about the condition is also important. Rheumatoid arthritis is the most serious of the conditions under this heading and affects 3 times as many women as men. Nearly 80% of the people afflicted with arthritis are stricken between the ages of 25 and 50. McLean, ed. 1993. In some cases, the various forms of arthritis can become so severe that joint replacement surgery is the only hope for relief from the pain and an ability to return to activity of any kind. Protein needs through the years. For those who are age 19 to 55, the typical daily protein need is 0.4-0.8 grams per kilogram of body weight. However, the need might be slightly greater in those who are very active. Once a person reaches the age of 55, however, they may need additional protein in their diets for a number of reasons. Extra protein is needed for those who are suffering from illnesses, unless there are certain types which can be worsened by protein, accidents or trauma, burns, bed sores and surgery. A person who is 55 or older may be encouraged to add additional protein, as much as a full gram per kg of body weight, nearly a third more than is normally recommended. The general problem with an older person is his or her decreased appetite. It might be important then for the older person to get some of their protein from supplements for ease of use. A healthy anti-inflammatory diet. There are a number of diet plans that are suggested to reduce the risk of developing some age-related diseases and conditions. However, because rheumatoid arthritis is not technically age-based and is considered an autoimmune disorder, it is not affected by modifications in diet plans. Before considering a dietary change of any kind, consultation with a doctor and/or nutritionist is advised, especially if there are other underlying health conditions to consider. The 3 macronutrients, protein, carbohydrates and fats, are important, but must be part of an overall healthy, balanced and varied diet. Whether you choose to get your foods from animal sources or not is entirely a personal decision. There are healthy choices for fats and proteins in both animal and plant forms. The first step for finding out how much you should eat is to know how many calories that you need each day. After you learn how many calories are right for you, you can start to devise an eating plan which should be 40 to 50% complex carbohydrates, 30% healthy fats and 20 to 30% protein. Protein intake should not go higher than 35% of the daily calories unless specifically directed by a doctor. Each of the 3 macronutrients should be included at each meal. The amount of protein that you eat may either increase or decrease, depending on specific needs. For instance, in the presence of rheumatoid arthritis, an autoimmune disease, protein intake should be slightly lower. Antibodies are proteins and may cause further damage. Protein on the anti-inflammatory diet should come from plant-based sources as much as possible, with the exception of fish and reduced-fat dairy. Whey protein supplements are also a good choice. Source: Bio, 2005. The pain of arthritis and its vicious cycle. Arthritis can cause so much pain that the daily activities of life, including eating and drinking or cooking a meal, can be next to impossible to do. Some of the medications can cause stomach upset, making the person even less likely to eat the right foods in the right amounts. The less food that they take in, the weaker they may be, leaving them more susceptible to flare-ups and attacks, and then the cycle continues on. Making sure that you are eating the right amount of foods and getting the right nutrients can keep you stronger and healthier and may make some of the other treatments for your arthritis more effective. If you are feeling your best, you can put your best effort into your physical therapy, for instance. The better that you are eating, the stronger your body will be. Protein works to build, repair and maintain the connective tissues in the body as well as the contracted muscular tissues. If these muscles are strong and supple, there might not be as much strain and pulling on the joints, which in turn can mean less degeneration and damage. Muscular pain and imbalance may be the start of some of the forms of arthritis and of back pain as well. In fact, back pain is around 85% muscular in nature rather than structural. Source: Lockhart, 2006. Just as you need to make sure that you are getting the right nutrition for any other condition or disease in the body, you also can prevent or treat some forms of arthritis with good nutrition and exercise as well. Choosing a protein supplement, it is important to consider the amount of protein that you need as well as the kind that you should be getting. The wrong protein can be just as bad as too much or too little. If you are following the anti-inflammatory diet, you will be aiming to limit the amount of animal-based protein that you are getting, opting for other protein sources such as protein powders, whey, rice, soy and egg, or others. With arthritis, you should also look at each protein source based on how easy and convenient they are to eat or drink. Can they be easily opened? Do they need to be mixed? Are they heavy or difficult to hold cans? Protein bars are a quick source of protein but should have no more than a few grams of sugar in them. Protein shakes are typically convenient and come in 3 flavors in most brands. The powders each have different types of protein but must be mixed before being consumed. One of the fastest and easiest ways to meet your protein needs is with a liquid protein supplement shot. ProfectR, from Protica, is small, easy to carry around and quickly opened and consumed. It is less than 3 ounces in size and has 25 grams of protein in it and only 100 calories. It comes in a number of fruit-based flavors and unlike many of the commercially available protein shakes and supplements, it has no added fats or carbohydrates at all.